it's time for Vision Talk. This is our monthly Vision Talk program from Vision Bermuda. And today, sitting across from me, is Jenny Faries, who is the Managing Director of Insight Ltd. Get the right microphone on for you, Jenny. There you go. Welcome.
Thank you.
Good to have you here. And
Awesome to be here.
so the fact that Jenny, who is trained at Dalhousie University in Canada to become a certified orthoptist, she's been back home working in Bermuda since 2016, evaluating many difficult eye-related complaints such as double vision, lazy eye, crossed eyes, droopy eyelids, and abnormal eye movements such as nystagmus. So as an orthoptist, she is not only responsible for evaluating and helping to diagnose eye movement issues, but is also highly trained to identify visual issues in babies and children. Jenny works alongside ophthalmologist Dr. Lucia Kofova and Dr. Karina Cooper at Inside Comprehensive Eye Care, which is located at 32 Victoria Street in Hamilton. So Jenny, welcome. Good to have you here.
Thank you so much for having me.
And every month, Teresa and I try and, get as much information out there for our folks to, help eyesight, prevent sight loss if we possibly can. And, of course, that is something you're a big part of. You want to just tell our listeners a little bit about yourself and why you decided to become an orthoptist and maybe how that differs from being an optometrist or an ophthalmologist?
Sure. So thank you so much for having me, and thank you to Vision Bermuda. This is an awesome opportunity. Every time I say I'm an orthoptist, people look at me a bit blankly.
Like what? Huh?
An orthoptist is someone who diagnoses and sometimes treats eye muscle and eye movement problems.
Gotcha.
Figuring out why the eyes are not working together, and often, especially with kids and babies who are harder to test, it's figuring out just what is the problem,
Gotcha.
if any.
Mm-hmm.
So I went into this after quite a long search for what to do with my life. I knew I wanted to do something that helps people.
Sure.
I just wanted to feel like what I'm doing for work is something that's making a difference.
I think didn't you meet someone who was an optical technician or an orthoptist, and they said, "Hey,
yes,
how about you should try this?"
Yeah, Vicky, who was an orthoptist back when I was looking, she said, "You should check this out." So I went and shadowed her, and that was that. I was hooked. It's quite fun interacting with. I liked the idea of interacting with different people all day, and solving a mystery. It's often like when someone comes to you, they have a complaint. You have to figure out, how do I help this person?
Sure.
When you figure it out, it's super rewarding.
Well, good stuff. I mean, when it comes to eyesight and the things that can happen that affect your eyesight and can lead to sight loss, which is everything that Vision Bermuda deals with on a regular basis. But you're kind of super into the prevention and to the correction, I should say, prevention of sight loss and the correction of sight issues. Now, oftentimes we see those wonderful videos of a baby getting a pair of glasses and how their world lights up. You can imagine, various things cause a sight impairment in babies and young children. And I've often wondered how the baby can't tell you, yeah, I can focus now, right? So I think that's, maybe you can explain a little bit, because that is your specialty, figuring out how to get that perfect pair of glasses, because sometimes they're quite thick lenses or something, or they do corrections, like I have glasses with what we call prisms in them for double vision. So how exactly, how do you do that, Jenny? That little bit of magic and put those smiles on those babies' faces?
So there are lots of tests that we can do, as eye care professionals, not just orthoptists, but that are objective. So they're just like, for example, you put in drops and you do the tests with the machine or device, and it tells you a measurement, more or less. And then there are a lot of things that, like for me, my specialty, and one thing that I think is maybe unique to an orthoptist, is I'm very much trained to look at what are the eyes doing in reaction to, for example, what I present to them, or So with babies, that's the big thing. You
Sure.
have to, you know what you're presenting and what you expect them to do in reaction. And if they do it, then maybe that's the normal reaction. And if they don't, then you can interpret
That
what
they
they've
can't
done.
quite see something
Yeah,
or
so-
something different.
Yeah, exactly. Like,
Okay.
how the eyes are moving is, a huge telltale sign, depending on what I've done to get them to move, if that makes sense. So the younger the patient is, the more it's me looking for those signs rather
Gotcha.
than them telling me.
Exactly. Now we've all, coming up or met someone or seen someone with, what they commonly call lazy eye, in kids, and often seen, a couple preschoolers with an eye patch or something on. And what sort of causes these things? Maybe, I guess, is what I'm asking. Is it a developmental thing while they're in utero that happens, or is it congenital? Like what causes that type of thing?
Well, lazy eye is a term that's used to refer to lots of different things.
I was going to say
be-
it probably covers a few things.
A lot of people use that to refer to like a droopy lid,
Okay.
and others use it to refer to an eye turn.
Sure,
like the
either
eye turns
in or out,
or
yeah,
up potentially.
Or, yeah.
So it depends what obviously we're talking about, but if it's an eye turn, it can be congenital. So you could be born with it, and that's just
Something in your DNA.
yeah.
Okay.
It can be from syndromes, like if you have other genetic issues going
Gotcha.
on. Some kids just have it
Sure.
right from birth. Sometimes it's a focusing problem.
Okay.
So if you need glasses for focusing to see up close, for example, and you don't have them, your eyes might overreact to focus, and it actually brings the eyes in. So that's one option. There's a lot of different causes.
Gotcha.
So,
Yeah.
another thing that can cause it actually is when if a child needs glasses and they're not given them, or it hasn't been detected yet.
Sure.
If one eye sees a lot worse than the other, then that eye can start to get ignored by the brain.
Okay.
And that can cause the eye to drift, because the
So you
brain
lose the muscle
says,
control, right?
The brain just says, "Look, I don't
need you."
need that." Yeah.
Oh, wow.
Yeah. So lots of things can cause it, and basically, if you're a parent that sees an eye turn, or seems like your child's eyes are not quite aligned sometimes, best to get it checked, because
Sure.
it could be something like they just need glasses, and it could be a simple fix. And if it's unfortunately there are usually not with kids, but potentially anybody. If you have an eye turn that comes on all of a sudden, it can be something quite worrisome.
Quite dramatic.
So that is,
Okay.
if it's just a sudden, you see an eye turn. If you're an adult and you see double,
All of a sudden you wake up and you're like, wow.
That's
Yeah.
my specialty.
Sure,
Come
okay.
and see me.
All right.
But, get seen. And then if a child has an eye turn all of a sudden, again, get seen. Yeah.
So do you see all ages, or your specialty is in young folk?
I definitely see all ages. I work alongside an ophthalmologist. So an orthoptist is sort of like an ophthalmologist's right arm.
Okay,
or,
understood.
So
You do all the preliminary stuff
Yeah,
necessary.
I do all these specific tests for these types of complaints, and then I tell the doctor, here's what this steps out to be. This is what my testing says, and then together, or the ophthalmologist may decide on their own what to do about it.
What to do about it? Gotcha.
So, yeah.
So when we see kids, young kids with an eye patch on, what is that doing? I know it's something about, okay, do you cover the good eye so the other eye can sort of gain a little muscle definition there, or?
So patching is treating what's called amblyopia. So in that scenario where, let's say, one eye needs a stronger lens than the other, or doesn't see well for some reason, and the other eye, it sees worse than the other eye. In order to, if it's at a point where the brain's ignoring it, like it's gotten to really quite bad, then we need to force the brain to use
Talk to that
bad
eye again, yeah.
So you would give the child the glasses they need so that both eyes are seeing clearly now. But then because there's been some time, obviously, where that eye it was not seeing well, and the brain
wasn't doing its workout, so its muscles got weak.
Basically, it's not communicating with the brain. So
Okay.
you have to force the brain to start using it. And by patching the good eye, the brain has to use that
Gotcha.
now bad eye. And if the child's young enough, it will usually work. And so over a little bit of time with patching, that eye connection to the brain strengthens and
again. Yeah.
we save the vision. If it doesn't, the visual development kind of ends around age 8 to 10.
Got you. Okay. I
So
was going to ask
patching
you
needs
that.
to be done before that in order to really work.
Like why? That's sort of like why is early detection so important then?
Yeah,
For
you
that
don't-
reason, and many others you're probably going to tell us.
Yes.
Uh-huh.
So yeah, you don't want to leave a child with a visual impairment
Sure.
and not get it treated, basically.
Yeah. So if a baby's born with like a severely turned in eye, is that something that should be addressed immediately in the infant?
Obviously, yeah, you should get it seen and find out why. Because you want to rule out anything sinister causing it.
Gotcha.
And then if it's just congenital, they're born with that, and it's just a muscle imbalance, then eventually they can have muscle surgery to fix
Gotcha.
it, to make it look better and feel better. Yeah.
Okay.
And hopefully save some vision. Yeah.
What other things can cause some of the issues in children that you're specializing in, Jenny? Like what are, gosh, we don't want to think of children. Do children get glaucoma from young? Like what other
Sure.
what do we call it? The silent killer type things, silent sight stealers can go on in babies.
So children can definitely get glaucoma. That is hard. You wouldn't necessarily see it, although, once, unfortunately, when that is bad,
Sure.
it's bad,
Sure. The sight is gone.
It's a silent killer, like you said.
Silent
So
stealer of sight. Yeah.
basically, if a baby's eyes don't quite look right, if you
Sure.
see like a white pupil or discoloration,
Cloudiness of any sort in the iris, things
right,
like that. Yeah.
anything like that,
Uh-huh.
you would get it checked. These are signs that something's up,
Something's wrong. Yeah.
right?
Uh-huh.
But so yeah, I mean, my specialty as an orthoptist is like I can rule out visual issues. So for example, with kids that are having problems with reading or
Right. Okay.
so
So they've come up to an age,
or they've failed
past
vision
grade 2 or something.
screening.
Yeah. Okay.
Those kids could come to me and I can check everything under the sun and make
Sure.
sure that there's no eye-related issue causing it.
Gotcha.
And often there isn't, but it's good to rule out.
Good to rule out. I know there are some. I remember someone saying that how your lenses focus and the speed of that can be an issue, with being able to read and being able to read with clarity and with any sort of speed. And there are things that cause that, or it can just be corrected with lenses.
Well, so obviously you want to be getting your child in the right glasses.
Sure.
Once they're in the right glasses, usually that is enough.
Gotcha.
And I can rule out any other eye movement issues. But I would caution parents to make sure that they're not ignoring what might be another problem. So the reason I think ruling out the eye issue
Sure.
is crucial, and then getting whatever help is needed if
For what
that's
the
not
real
it.
issue is. Exactly, yeah.
I think often what's happening is it's really trendy these days to blame like a reading difficulty on a
Eyesight.
tracking problem or
Okay.
like
Some of those catchphrases.
focusing issues, and then the child gets put into vision therapy, which is a whole
Isn't what
big
they really
kettle
need.
of fish.
Yeah,
I think a lot of times they need a reading tutor or
Sure.
a
some sort
like
of
the reading
structural
clinic,
thing going on.
test for whatever else is going on, and then yeah. So
Sometimes hard to tell that to parents, I bet.
it's very difficult. Yes.
So you get your certificate in diplomacy, right?
Exactly.
In order to be in this business, right? But we're trying to bring a little levity to it. But our discussions are always very serious, and we hope to get the point across that, prevention, the whole, an ounce of prevention is worth a pound of cure. What type of treatments then do you offer? If there is an issue, apart from, we can get them an eye patch if they have a muscle issue. What else goes on?
Okay, so the patching is actually, it's not necessarily for the muscle issue.
Okay.
It's for the vision.
The vision, right?
Right?
Making the brain
Exactly.
do what it's supposed to do.
But yes, patching is one of the things that I would treat with
Sure.
more or less alone. I'm supervised by the ophthalmologist.
Sure.
Prisms you mentioned. So when
right.
someone has double vision and it's either maybe a small issue that is not really ready for surgery, or it's a sudden issue, and like sometimes a diabetic issue or like a stroke can cause
right.
an eye turn, and it has to just get better on its own.
Gotcha.
So that person may need a prism to help them not see double while
For a
they
while.
wait for that to heal.
Gotcha. Okay.
So that is definitely one of my specialties, prism, or, treatment of double vision, figuring out the cause. Lenses. So sometimes, there's lots of tricky issues that a little creativity can create such relief for someone.
Sure.
So different lenses, or putting prism in the lens.
You're talking about
just
contacts when you say lenses, or you're talking about glass lenses?
Types of glasses.
Okay,
yeah,
glasses.
yeah.
Okay.
So like, there's lots of scenarios where patients come and they're just frustrated with something's wrong. Like either my glasses just don't seem right, and whatever it might be, and that's almost my favorite type of patient, because I love to investigate.
You want to figure it out.
Yeah. So figuring out the problem, and if it's not my realm to treat, I might, our clinic would refer to the optometrist to get the lenses, or, wherever else, to a strabismus surgeon who does the eye muscle surgery and all that. Yeah, so lenses, prisms, patches, I can't think. Oh, exercises. So one thing, that's another sort of trendy thing. People think that a lot of things can be treated with exercises. I do have some exercises that I'll recommend and help people do and monitor. But there's not a ton of eye exercises that help.
The left, right, up, down. I mean, like how much more can you exercise those eye muscles?
Exactly. We're
What is
always
involved
using
with that.
We're using our eye muscles all the time. So
Sure.
we're always exercising our eye muscles. But to make them do something that they're not already doing naturally, if they're not acting the way they should, is quite difficult to force your eyes. A lot of people can cross their eyes, on purpose, and that is essentially an exercise.
That's an exercise, yeah.
If you're somebody who has a weakness of the muscles that pull your eyes in, then creating there is an exercise that can force you to do that, and that works quite well if people do it.
Is getting them to do it part of the problem? Is that what you're saying?
We just want a quick fix.
Sure,
Everyone wants
lots
a quick
of times
fix.
that happens. Yeah.
But yes, yeah.
So we often refer to Teresa as a vision rehab specialist, and that's different.
Yeah.
What Teresa does is different, right? You're diagnosing and getting treatment, but rehab when someone has lost their sight.
Yeah. So in my clinic, Dr. Kufova is a retinal specialist. So we have a lot of patients who are maybe losing some sight from macular degeneration or diabetics who have not had good control. Yeah. So we have a lot of patients, not just those, but others too, who have lost some vision for some reason. And my job is not just to do all what we've discussed,
Sure.
but to help with testing before they see the doctor. And then we help arrange if they need help figuring out how to live their life like normal,
Sure.
despite vision loss, then we would refer to Teresa, and
Gotcha.
she's amazing. Yeah.
She is amazing. We can't say enough about how amazing and
Yeah.
how hard she works for those who are living with vision loss now, whatever degree of vision loss that might be. I don't know on the island now the prevalence of sight loss in kids. I don't know if you know, do you see many children dealing with major vision loss, or do you see any that are, do you ever see ones that are perhaps born with sight issues already, like decreased vision of sorts?
We do see some, but it's not very common.
Not common here,
We have
yeah.
such a small population.
Uh-huh.
Thankfully,
Yeah.
it is a small number. I think the statistical number of patients who have some sort of eye muscle issue, like I'm trained to deal with, is worldwide is
Sure.
like, I think it's 2 to 5%,
Okay.
which is not very high, but maybe it's just because of where I work and how I work. It just seems like everyone has a little something.
A little something going on, right?
So don't be ashamed to come and check it out.
If you
'cause
do,
it's
yeah.
very, yeah.
It's not it's
Very
not something to be
common.
ashamed of. It's quite common. And so you have been in business, and where's your office again, Jen?
So it's Insight Comprehensive Eye Care. It's 32 Victoria Street.
Okay.
We are across from the Sears store, basically.
Okay. Yeah.
it's-
All right. In that older building, it's a lovely building there.
It's actually, well, there's a couple old buildings,
Okay.
but we're the newer building. It's
You're
a
the newer
lovely
one.
office,
Okay, I
yeah.
know exactly what you're talking about then.
There's-
Yeah, I always
there's
said office
parking
building.
there.
Good parking and everything.
And
And people can get a hold of Jenny at 601-6162. Insight Comprehensive Eye Care. You've been open just about
Just since June.
9 months or so, or a little over. That would be 7 months or so now, and things are going great there. And you're talking about having some visits, hopefully by eye surgeon as well, which is something I'm sure some people out there would be like, "Phew," it's not having to think about fly away for certain things and stuff like that.
yeah, I would like to have a pediatric and eye muscle surgeon come and visit soon, starting doing, maybe every 3 months
Gotcha.
visit here, so that we can get some surgeries done here and not, like you said, not have to send people away.
Yeah, make a
'Cause
difference in people's lives, both with, helping with double vision, but also, it's tough, especially for the youngsters, cosmetically to look different
Yeah.
from their peers. And
Yeah.
so we don't want them, kids can be mean.
Yeah.
And that's a tough thing that all parents have to deal with. So hopefully anyone out there who might have a youngster dealing with some of the issues we've just been talking to Jenny about, if you're just joining us, this is our monthly Vision Talk, second Monday of every month here on Ocean 89. And Jenny Faries is the managing director of the Insight Comprehensive Eye Care, that is. And she works alongside Dr. Lucia Kafova and Dr. Karina Cooper. And as the retinal specialist, we've mentioned with other interviews that it should be in your general care, along with your GP, to see an ophthalmologist because the retina can show underlying issues ahead of metabolic disease and certain other things like that too. So do you find that perhaps you might have rang that alarm bell once they've come in and had an eye exam, saying, "Oh, you need to do this, this, and this because your retina is telling me."
Yeah.
Things like what did they call them? Micro bleeds and things like that happen
Exactly.
in the retina.
Yeah, so if people are diabetic, especially if they're not well controlled, they should really be seen once a year, because the changes in your retina can happen much before you see any vision
Sure.
problem, right?
Gotcha.
So if the ophthalmologist catches it, they can treat it much more sort of
Effectively.
gently and effectively
and
before it
retain
gets out
your
of hand.
sight. Yes,
Exactly.
because in the end, if you don't do these things, sight loss of some sort, and perhaps totally can be the result of not doing the proper thing. So, do people have to be referred to come see you, Jen?
No, they can call us and
Sure.
we can organize it. Yeah. You don't need a referral.
It is nice to have a GP.
It's great. It's great to have a referral.
You should
for
see one
sure.
annually. We're just saying. And but even if you aren't prompted by your GP, it's a good idea for you to
Exactly.
come in and have an eye exam. I think we've covered just about everything we can talk about. Is there anything, Jenny, you want to say to our listeners out there? Of course, we've been talking about the importance of detecting visual issues in childhood, but we did say that you treat adults too.
We do cataract surgery,
Okay.
lid surgeries,
Uh-huh.
Dr. Kufova's diabetes and retinal
Specials,
surgeon.
yeah,
So we're kind of covering pretty much all the bases. They're both general ophthalmologists as well.
Mm-hmm.
And I'm there for your children and muscle issues.
Sure.
And give us a call.
Good stuff.
Insight Limited.
Yep. Insight specialists, of course, and we've been talking to Jenny Faries, who is it's her company, as she told me, Insight Comprehensive Eye Care. Awesome, on Victoria Street, right across from the Sears building there. Go and check them out. So we want to thank you for coming and being part of Vision Bermuda's Vision Talk monthly program, Jenny, and I'm sure we'll be talking with you again at some point in the not too distant future.
Thank you so much.
We know that good things are going to be coming of this, and I guess the main thing we want to say is don't wait,
Yeah.
Thankfully, we have sort of pretty up there prenatal care and pregnancy care for women, so when babies are born, if something does looks like it's gone awry, then there are ways to get help right away here.
Yeah.
And we're lucky that we have that, and we're glad people like you do what you do, so we can have a few parents sleep a little better at night and have their kids enjoy growing up. And I guess there's nothing better. I guess you've probably witnessed it, where you've had that youngster get that first pair of glasses and seen their eyes literally light up, because now
For sure.
their brain is saying, wow.
Yes.
Right? Look at this.
Exactly.
And we hope that continues for you, Jenny. I want to thank you for coming by today.
Thanks so
And
much.
good
Shelley.
luck with
It's
Insight.
great.
Good to see
Appreciate
you
it.
again.
And thank you to Vision Bermuda.
And just so you know, Vision Bermuda is on Vision Talk from Vision Bermuda is on the second Monday, of every month at 5:15 right here. We will repeat the program tomorrow night at 5:15 on Power 95. If you think anyone needs to hear about what we've been talking about, anyone can contact Vision Bermuda at info@visionbermuda.pm. You can send them an email. They would love for you to check out their Facebook and like their page. And I know they're still looking for folks to come help with the talk to write issues with the iPads. So we're still looking for volunteers for that at Vision Bermuda, folks. So give them a shout if that's something you want to help out with. Once again, Jenny, thanks for coming by. We appreciate you doing what you do.
Thank you so
Take
much.
care.
Take care.